Okay, friends, last Friday, I think it was, we had a chance to kind of go over some notes and about the human circulatory system, specifically the blood, not the lymphatic, and was basically based on some of the beginning objectives. We already did the functions, and the next part of the objective was about the blood vessels, which was basically what is the function and structure of the arteries, veins, and capillaries. And here's a nice little picture of all the different vessels involved. So arteries, or small arteries here, arterioles, the capillaries, the veins, and there's small veins right there. So this shows some of the major arteries leading away from the heart. This would be the aorta we'll talk about, and some of the other things we'll be talking about. There is a carotid artery. There's that nice picture of a once living person where they put that plastic inside their blood vessels. Kind of cool. Now the deal with arteries is they take blood away from the heart. Artery starts with A, away starts with A. That's one way to remember that. And here's some examples of some arteries. There's aorta, which is probably our biggest artery, pulmonary arteries, which take blood away from the heart to the lungs, and some of the circulatory system that goes towards away from the heart, believe it or not, but then back to the heart, the coronary, or the heart circulation. And speaking of the heart, there it is again. Now, in order to withstand that pressure that's coming out, we have reasonably thick-walled artery rather. And it's also that artery that you feel when you get your pulse, because it actually gives every time that your ventricles contract. Veins bring blood back to the heart. That's their function basically, is to return the blood back. And because they don't have and since they're so far away from the heart and the pump, they don't have as much pressure, so therefore they don't have to be as thick-walled. And when we compare the two, you can see that in the arteries it's much thicker walled, and the veins not so much. And the veins also tend to have a wider diameter, a little bigger too, in that regard. Then the capillaries, the third type of vessel, the importance of those, of course, is this is where all materials enter and leave the blood. And so waste would probably be going into the blood at this point from all the surrounding cells. If you're at the lungs, oxygen would be going in, carbon dioxide going out. But if it wasn't the lungs, it'd just be the opposite, where the cells would use the oxygen for respiration and give off carbon dioxide. And probably all your body cells, all the sugars and nutrients, amino acids would be going out, except if we were at the small intestine where that stuff's being absorbed, it would be going in. So it just depends on where the blood vessels are going. Okay, valves, that's an important one. And valves, back in this little picture here, are found in your veins only. And they help keep the blood moving in one direction. And when I've mentioned, and you may have heard this, that when you say, like, get up and start moving around, get your blood flowing, get some circulation going, well, part of that is true in that every time you stretch and move your muscles are contracting, and you're probably pushing against bone, and in between the bone and the muscle may be veins, and when they get squished like that, the blood flows in one direction. And here's a little video clip to kind of show that.
One-way valves that work in conjunction with skeletal muscles. When the skeletal muscles contract, the valves open, and blood is forced toward the heart. When the skeletal muscles relax, the valves close to prevent the backflow of blood away from the heart.
And I also thought it might be interesting to show you this little video where this is a person's arm, obviously, and these are some veins here. And you can actually locate where the valves might be.
All set? Yep. Okay. So I want to show you folks how to do a IV and check for a valve first, because you do not want to stick an IV catheter through a valve in a vein. It is very painful for the patient. Also, if the tip of your catheter lies next to or in the valve, you won't get good fluid flow through the catheter. So to avoid it, there's a very quick check you can do. First of all, find a vein that you're thinking of doing an IV in. And what you're going to do is you're going to occlude the vein distally. This prevents any flowing of blood into the vein to head back to the heart. Once it's occluded, take your other finger and just push that blood out of the vein. Where the blood backflows to, that's where the valve is. Gravity is pushing the blood back down the vein, but the valve, which is a one-way valve, prevents it from filling the rest of the way. And since I'm not allowing any blood flow to return to the heart, you can clearly see this area of the vein no valves. That's where the valve is. This is where you want to put your catheter. So I'll show you that again. Occlude the vein, push the blood out of it, and wherever gravity lets it backflow to, that's the valve. It can't go any further. So you're going to... All set?
I thought that was just kind of interesting to see that. That happened to me one time when I gave blood and they stuck the needle right in the valve, and that didn't work so well. Now, I also point out that in your heart, you also have valves, and they do the exact same function. What they do is they prevent blood from going back the wrong way. Again, it only goes in one direction. So, for example, here what happens is that this is the lower part of your heart, the ventricle. When it contracts, it forces blood up and out, away from the heart, and if these valves weren't here to kind of squishle back into the back in the atrium. So these are important both in your veins and in your heart. Okay, explain how the structure of capillaries allow for materials to move into and out of the bloodstream. Well, as you saw before, basically it comes down to the fact that they're very, very thin-walled. They're very small and narrow and allows for materials to diffuse through very easily. And here's a nice picture of red blood cells going single file. Sometimes we actually even say that the capillaries are leaky because the fluid leaks through. So in addition to diffusion, the actual fluid, like aka the plasma, leaks through, and dissolved in that plasma are some of the nutrients and materials, etc. Okay, number 5 is a biggie. Well, it's a pretty common one too, which is to trace the flow of blood into and out of the heart. And these are a few of the structures I'd like you to know. Looks like a long list, but there's not a lot there really, and they're also, most of them are pretty descriptive. So here's a diagram of the heart, and you have a copy of this. Just a couple quick things about anatomy drawings in general. When you look at the right side and left side, it looks backwards when it's in front of you on a piece of paper, because as far as I know, this is the right side of the screen, this is the left side of the screen, but all anatomy is kind of drawn as if you're looking down at yourself. So that kind of solves that mystery. So of course, when it comes to the heart, there's a right side and a left side. Not only that, there's a top and a bottom. And the top of the heart is called the atrium, and so there's a right atrium and a left atrium, and down below is a right ventricle and left ventricle. And so there's, again, left and right side, top and bottom. So that makes your life easy to identify parts here. So we'll start with blood coming into the heart, so therefore it's going to come in via vein, hence the vena cava. And this is blood coming from all parts of your body except for your lungs. The reason I have it in purplish like this is because if you look at your arm and see a vein, you might see it's like blue vein. Well, in reality, your blood's not blue, but it's kind of this dark purpley color, but through the skin it appears blue. And of course, if you cut yourself or expose blood to the air, it immediately turns bright red because the oxygen meets the hemoglobin. This oxyhemoglobin complex turns bright red. And keep in mind also there's little arrows here. I'll draw some bigger ones in to show, to kind of emphasize that. So blood comes in via the vena cava, and there's a superior inferior. This one's coming from the top of the body, the head and upper torso, except for the lungs, and this one's coming from your legs and your lower trunks. So as the blood then enters into the top of the top of the heart being the atrium, and this being the right side of the heart, it's the right atrium. Right atrium contracts and blood gets forced down here. Now I didn't throw it in here, but at this junction here, there's also some valves, which again prevent the one-way flow, and of course those valves will be going this way. In between the right atrium and the right ventricle, I didn't put a number here, or didn't really label it per se, but letter I here is a valve, and this is one of 2 valves I'd like you to know. There's other names for it, but I'm going to make it simple, just call it the right atrioventricle valve, so that when the atrium contracts, it forces blood down to the ventricle. And there'll be something very similar here too, which would be the left atrium ventricle valve. There's fancier names for these, bicuspid or tricuspid valve or mitral valve, but we'll just go with the simple atrioventricle valve. So blood goes down the right ventricle contracts, and that forces blood up and out of the lung, excuse me, up and out of the heart, but it's going to be going to the lungs. And so any vessel leaving the lungs is going to be an artery, and sure enough, B is the pulmonary artery. And pulmonary, if you've seen that term, which you have as in CPR, that's what the P stands for in CPR. Whenever you hear that word pulmonary, you think of the blood and lungs kind of complex. And so the blood gets pumped up the lungs, and at the lungs they pick up oxygen, get rid of CO2, and then they make a return trip. And of course, this would be happening in capillaries up at the lungs. Okay, the return trip back, Now it's highly oxygenated blood. That's why I have it in red now. It comes in via a vein, and these are called the pulmonary veins. And the pulmonary veins, one from the right lung, one from the left lung, empties into the top of the left side. So therefore it goes into the left atrium, goes through the atrioventricular valve again, and then it goes down into the left ventricle. And then eventually the ventricle contracts, and because of the valves, it goes in one direction and out the aorta to all parts of the body. Then it comes back in via the vena cava again. So it's a continual circuit from blood being pumped out of the left side into the right side, out of the right side and the left side, etc., all the way through. And last structure, just to note here, is this separating wall between the left side and the right side, which is called the septum. If you ever heard of someone having a deviated septum, it's not about their heart, but it's about their nose and the division between their nostrils, basically. If you look up if you Google blue baby, you may find a medical condition which is pretty sad, whereby some babies are born with a congenital birth defect in their heart, where there's a hole in between here. And what happens is that the bloods mix, and that's not a good thing. And because it's very deoxygenated, they tend to look blue in the face, kind of thing. Though it can be repaired, which is a good thing. Just throw something about the pulse, not objective, but you did that little like mini lab last week where you tested your pulse and did something to see if you could increase it or decrease it. Most people did exercise, but a normal pulse is somewhere between 60 and 100, and that's what most of you guys are getting. And again, this is beats per minute. Though generally speaking, if you have a slower pulse rate, that means you may be in a little better shape because your heart's being more efficient at pumping things. And as you might recall that you used the radial artery, you put your two fingers on there to kind of get the pulse. And the reason you didn't do your thumb is because there's a pretty good size artery that goes through your thumb, and if you were to use your thumb, you probably might feel that actually, and that would kind of throw you off. You also can take it through your carotid artery. That's that major artery that goes up to your brain, and you can feel it there also. And this is why someone slits their throat, why it can be so lethal very quickly, because all this blood's like gushing out. It's under a lot of pressure. And this is showing something we'll talk about in a bit about when arteries or veins, any blood vessel really gets clogged, and that'd be really serious to have this one clogged because you'd be missing blood and sugar and oxygen to your brain. And some of you guys did little activities where you did activity versus heart rate before and after exercise, and most people found that your heart rate went up. And here's another good one that these guys did. Okay, so back to the objective. Describe the path of blood through the pulmonary circulation, systemic circulation, and the hepatic, portal, coronary, and renal circulation. So let's start with the general circulation again. That here's your right side and left side. This is the vena cava coming in, goes up to the lungs and back again. And what I just described there, which is this first part, which is blood leaving your right side of your heart, going up to the lungs, then back again. That is basically your pulmonary circulation. And so pulmonary circulation takes blood to the lungs from the heart to pick up oxygen and then return it back to the heart. Or you could say that it takes blood to the lungs to give away carbon dioxide. That'd be another way of looking at that too. And systemic circulation is all the rest of it. So systemic circulation is when blood leaves the lungs. In this case would be, or I should say when blood leaves the heart except for the lung, and goes every place except for the lungs, and then it comes back again to the heart with oxygen from the lungs. Easy for me to say. What I was trying to say was it leaves your heart via your aorta and then comes back again via the vena cava. And here's again what that would look like. So it's the blood going out of the aorta, going to all the body parts, and coming in again back via the vena cava here. Okay, last couple things. Coronary circulation is part of the systemic circulation because it's going to something other than the lungs. And when you hear the word coronary, you think heart. And so it's just the blood circulation going to the heart. And here's a classic picture of your heart. And these little red vessels here would be arteries that kind of branch off out of the aorta and head towards the heart. And if any of these get blocked, serious issue. That could be a heart attack. So if, let's say it gets blocked right here, all these, whoops, lost my cursor, all these little pieces here would not receive any blood, therefore no oxygen. You might get this area of the heart very much damaged. So not a good thing. Hepatic portal circulation takes blood to the blank and the blank. And here, when you think about hepatic as in hepatitis, you think liver, and the portal refers to the small intestine. And this is a little bit different in that we're now talking about some veins here is the main part really. So if you remember back to what your small intestine does, it produces a lot of digestive enzymes, break things down, but it's also a site where things get absorbed, and they get absorbed into the blood. And so that if I was talking about this area here, the small intestine, and you're absorbing nutrients that you just digested, well, if it just went directly back into the circulation to the vena cava, it'd go to your heart and up to your lungs and etc. Eventually your brain. Well, the cool thing about this is that this is the portal part, but then the blood that leaves the small intestine takes a little trip first, and the trip is to the liver here. And the liver has several functions. You know that it makes bile for breaking down, for emulsifying fats. It produces some of your vitamins, stores sugars in terms of glycogen, but it also does a very important thing, which is if there's any poisons or toxins in your blood, it will actually detoxify it here in the liver and then send it back in the circulatory system cleaned up, so to speak. So it's a very nice evolutionary function of the liver to kind of help clean things. Because if you ate something that was toxic or poison, it just went directly in your bloodstream, it might get to your brain, other major organs, and do some serious damage. And lastly is the renal circulation. And the renal, whenever you hear that term, you think your kidneys. And the kidneys have several functions, but the one that we're going to think about here now is it takes the dirty blood in, so to speak, and returns it with clean blood. And as it gets filtered out there, all the waste and things end up in this little yellow structure, which is a ureter, which eventually goes down to your bladder, etc. And I think we know what happens, what the urinary bladder is all about. It stores your pee. And so that's what the renal circulation is about. So if you have renal failure, that means you have kidney failure. And if you have issues with your circulatory system in here, that could be deadly serious. So that's about it for the, I know I'm rambling on, but that's about it.